afternoon, Tony. How are you today?
Good, thank you.
Okay, you understand that you're here for a full head-to-toe physical exam, helping me out with my Liberty University online school project. That I'll be videotaping this afternoon, and my instructor will be viewing it.
Yes.
Okay. Have you taken any medication today?
No.
And are you experiencing any pain or discomfort today?
No.
Okay, we're going to go ahead and get started. I'm going to start by checking your temperature. Okay, and it's 98.8, so that's within normal limits. Okay, Tony, I'm going to check your blood pressure, but first I'm going to check for an oscillatory gap. Once I find that gap, then when I go to check your blood pressure, I'll go 30 millimeters of mercury above the oscillatory gap. And that was right about 118. Okay, I'm going to check your pulse. Okay, your pulse is 80 and your respirations are 16, and I would do your pulse for a full minute. Now we'll go ahead and check your blood pressure. And that was 118 over 72. Okay, next I'm just going to observe your skin. Okay, you are tan. Your skin is non-diaphoretic and warm. Do you go out in the sun?
Yes.
Okay, so I do see some macules and some pigment changes noted probably from that sun exposure. And do you shave your face and neck?
Yes.
Okay, I do note that also, as well as the male pattern hair distribution of dark hair, coarse hair, and I see a little bit of folliculitis on your neck there, probably from shaving. Okay, your arms also within what we'd expect for your ethnicity, with some macules from that sun exposure. Your skin turgor is elastic. Your hands are warm. Your forearms are warm. The skin is smooth. Your capillary refill is less than 3 seconds bilaterally. Your nails are smooth without ridging, and they adhere well to the nail beds. Tony, can you do your hands like this for me, please, putting your nails together? Very good. And your thumbs? Very good. So no clubbing is noted, and your angle is about 160, which is what we expect. Okay. I do notice some scarring on your knee here.
I had an ACL repair.
Okay, and the scar, it looks well healed. The scar lines or suture lines are well approximated. A few macules noted, and I do notice some distended veins here. You stand on your feet a lot?
Yes.
Okay. And the hair distribution again is expected for male. And I don't notice any clubbing or any edema, no clubbing of the toes or edema in the feet. Capillary refill on lower extremities is also less than 3 seconds. The nails are also smooth with no ridging, and the nails are well adhered to the nail beds. Okay, Tony, I'm going to check your hair and your scalp here. Your hair is thick and coarse, well, thinning in some spots, some male pattern baldness going on. I see you seem well hydrated. I don't see any flaking. No infestation is observed. Your scalp moves freely. Any pain or pressure up in here?
No.
Okay, very good. Okay, Tony. Now we're going to move on to your eyebrows. Your eyebrows are full and thick. Again, dark brown to black color in color, as with the rest of your hair. It comes together midline and extends beyond the outer canthus of the eye. Your eyelashes bend upward and outward, which is what we would expect to see. I see no exudate from the eyes. Your pupils are equal and round, and your iris are dark brown. Your sclera are clear. Your membranes are nice and pink. Very good. Now, Tony, do you recall that we did examine your eyes using the eye chart? We used both the Snellen and the Rosenbaum chart. The Snellen was for your distance. Remember, we had you at 6 feet away. We determined that your vision was 20/25 bilaterally, I believe. And what that means, Tony, is that what most people see at 25 feet, you can see at 20 feet. Okay, and then your Rosenbaum was you had normal vision bilaterally. Okay. Okay. Tony, I'm going to go ahead and feel your TMJ here. Go ahead and open your mouth for me and close it and go side to side with your lower jaw. Very good. And clench your teeth. Very good. And let them go. I'm going to check your lymph nodes, and we have your pre-auricular, your posterior auricular, your occipital parotid, your submandibular, sublingual, and submental, your anterior clavicular chain, or cervical chain, and your posterior cervical chain, your deep cervical chain, and your supraclavicular. Any tenderness when I touch those?
No.
Okay, very good. And I see that your trachea is midline and it moves up and down, as we would expect. I see no jugular vein distension or carotid distension, and your thyroid is not visible. Okay, so I'm going to go ahead and palpate for your thyroid. Okay, lean your head forward for me just a little bit and over to the right. Okay, and swallow. There you go. And to the left. And swallow. Very good, Tony. Okay. Now I'm just going to listen to your thyroid. Okay, and there are no rubs. No rubs and no buoy heard. Okay, now we're going to continue on with your eye exam. As we said, we already did the Snellen test and the Rosenbaum test on you. I'm going to go ahead and, before we get there, let's do this one. Let's close your eyes for me, and you're going to feel smooth and sharp, or dull and sharp. Okay, you tell me what you feel.
Sharp. Sharp. Smooth.
I want you to look straight ahead. And your pupils are equal, round, reactive to light and accommodation. I want you to follow the end of my pen light with your eye. tracking is equal. And I'm going to actually look in your eyes, Tony. Now for this exam, we would typically turn the light off, but for the sake of video, we're going to leave the light on. Okay, and I'm just going to have you look straight ahead for me. Okay. And red reflex is equal and present in both eyes. And I can see the optic disc, and it is round. And I see the retinal background. The fundus is creamy yellow, and I can see arterioles and venules at 3 to 5. No crossing observed, and the macula densa is gray. And same thing on this side, Tony. Red light reflex is present. Again, the retinal background is observed. The optic disc is round. The fundus is creamy yellow, and the macula densa is gray. And within the fundus, I see arterioles and venules at a 3 to 5 also on that side. Okay. Let me check your cornea here. The corneal light reflex is symmetrical. This is kind of cloudy. And no exophthalmos, and I noted no glaucoma in your eyes when I was examining. The eye exams that I've done, and the exams I've done so far, we've checked your optic nerve, we've checked when we did your jaw, we checked your trigeminal nerve as well. Okay, we checked your cranial lobes 3, 4, and 6, the trochlear, the oculomotor, and the abducens. Now I'm going to look at your ear. The first thing that I'm going to notice is that your ears are symmetrical, extending to your eye, the height of your eyebrow. The helix recoil well. There are no obvious lesions, any tenderness. Okay. And I'm going to examine the inner parts of your ear now, Tony. Small amount of cerumen in hairs. I see the tympanic membrane with the umbo, the malleus, the pars tendon, and the pars flats that are all visible, which we expect to find. And no cerumen in this one. I do see here, and the tympanic membrane is pearly gray with the umbo, malleus, pars tendon, pars flata also observed. Okay, Tony, now we're going to do a little bit of testing your hearing. This is acoustic, okay? So I'm going to make this make noise. I'm going to put it behind your ear, and you tell me when the sound stops, and then I'm going to hold it in front of your ear, and you again tell me when the sound stops, okay? Conduction, which is what we expect to find. And now I'm going to put it on the top of your head, and I want you to tell me if you can hear it in left, right, or both ears.
Both.
Tony, I'm going to stand behind you, and I'm going to whisper a few phrase, a word, and I want you to repeat it.
Baseball. Ice cream.
Very good. Tony, now we are going to have we'll examine your nose. Okay. First thing I'm going to do is I'm going to observe your nose is the same color, matches the rest of your face in color. it's midline, which is what we want to see. Light here. And your septum is also midline. Any tenderness?
No.
Tony, I'm going to have you occlude one side and go ahead and inhale for me. Very good. Okay, and the other side. Okay, and your mucosa in there is nice and pink and moist as well. Okay, now I'm going to have you close your eyes and close one side of your nose and tell me what you smell.
Lemon.
Okay, and we're going to do the same thing on the other side, Tony. What do you smell?
Cinnamon.
Yes, that's very good. Okay, and that was testing olfactory, which is cranial nerve number 1. Okay, I'm going to take a look at your mouth. Okay, the first thing I'm observing is your lips are nice and pink. They look moist, not chapped. Your gums are pink. Your frenulum are intact. Your teeth, are you a coffee drinker?
Yes.
Okay, they're a little bit yellowed. Okay, open your mouth. Open your mouth for me. Okay, I'm going to count your teeth. Good. Okay, 26, and I notice you have no dental caries, but you do have a filling on the lower right and the upper left. Okay, and stick out your tongue for me. And I do notice some fissures there. You indicated earlier that you've had that your whole life. Okay, and stick out your tongue, lift up your tongue. Okay, the Wharton's ducts are clearly visible. Put your tongue down. Okay, you're going to have me feel in your mouth. And I can palpate the Stenson's ducts. Okay, stick your tongue back out and say ah. Okay, and your uvula rises and falls midline, and your tonsils are about a 2+. Okay. Okay, now we're going to do a little bit of facial gymnastics. Okay, Tony, I want you to close your eyes. Okay, and raise your eyebrows with your eyes still closed. Okay, now close your eyes real tight and don't let me open them. Okay, very good. Open your eyes. Okay, I want you to puff your cheeks and purse your lips and show me your teeth. Now smile without showing me your teeth. There you go. And put your tongue in your cheek on both sides. Okay. Tony, can you jut your chin out for me? There you go. Okay, very good. Very good. Okay, next, Tony, what we're going to do is I'm going to look at your, maybe palpated your trachea or your thyroid. Okay, so we will move on then, and I am going to start with your chest and your breast exam. Okay, so can you remove your shirt for me, please? Okay, and again, I see some pigmentation, discoloration, some macules across the upper torso, probably related to the sun exposure that we discussed earlier. Go ahead and lean forward for me and put your hands over your head. Don't fall off the bed. There you go. And lean back. Okay, and rest your arms down. The breasts are symmetrical. I can see the rise and fall of the chest with respirations, and the width is twice the depth of the chest. Very good. Just palpate and feel. Okay. Tell me if you notice any tenderness.
No.
Okay. And I'm going to feel for any murmurs. Okay. Okay, and I don't feel any murmurs. I'm going to have you go ahead and lay down for me, Tony. Okay, and we're going to go ahead and do your breast exam. So go ahead and raise this arm above your head for me. Okay. And you just tell me if you feel any pain or tenderness.
No.
Okay. Exit it there, and we'll do the other side. Okay, pain or tenderness?
No.
Okay, great, and there's no exudate there. Okay, Tony, I'm going to listen to your heart. I'm going to start by listening to your heart. Okay, at your mitral valve. This is your PMI, or your apical. I'm going to compare that with your carotids. And they are even. And then I'm going to go to your tricuspid valve. Okay. Erb's point. And your aortic and pulmonic valves. Okay, and I heard S1, S2, which are the normal findings. S1 I heard loudest at your mitral and your tricuspid, and S2 I heard loudest at your aortic and pulmonic. Okay? We're going to go ahead and when I have you here, I'm going to check your pulses. Okay? I'm going to check your carotids. And your temporal. I'm going to check your brachial. And your labial. We've deferred the femorals. And your popliteal. Your posterior tibial pulses, and your dorsal pedal pulses. Very good. Okay, while you're laying there, Tony, I'm going to just listen to your carotids and your temporals. And I hear no brewing. Tony, I'm going to have you sit up for me. Okay. And I'm going to come right behind you, and I'm going to listen to your lungs and also measure your diaphragmatic excursion. I'll listen first. I want you to say the word 99.
99.
Again?
99.
Again?
99.
Very good. Okay, go ahead and take a deep breath in for me. Nice. And so his expansion is even. And now I'm going to check his diaphragmatic excursion. Tony, exhale for me and hold it. Okay. Now take a deep breath in and hold it. Okay. And you're measuring right at 4 centimeters. Okay, now I'm going to percuss your lungs. It's resonant. just looking at your abdomen. Okay, the skin coloration is still consistent with the rest of your body, and the hair distribution is that of male pattern hair distribution. The umbilicus is midline. Now, Tony, I'm going to listen to your abdomen. I'm going to listen to your bowel sounds, your aorta, and your renal and iliac arteries as well. Your thumb and aorta. Okay. And for your vowel sounds. There was no early noted on any of your arteries, and your vowel sounds are active times 4 quadrants. Now we're going to try and palpate and measure your liver and your spleen. We go from tympani to dole. As well. Same thing. Tony, I think that spleen is right up there under that rib cage right there, which is where we want it to be. That's a normal finding. Okay, so I'm not going to be able to palpate your spleen. But we are going to try and palpate your kidneys, so I just want you to relax here for just a minute. So you take a deep breath in for me and call. Okay. It's difficult to palpate your kidneys, although I didn't feel any nodules or anything like that, and your liver was nice and smooth surface with no nodules or anything. No pain or discomfort when I did that? Fantastic. Tony, I'm going to have you, we're going to go ahead and start checking your range of motion, and while I have you laying, we're going to go ahead and do your hips, okay? So Tony, I'm going to have you do flexion of your hip, inflection of your knee, and extension of your knee, and extension of your hip. Okay, we're going to do the same on this side. We're going to flex the hip, flex the knee, and extension of both. Okay, Tony, can you bend your knee here? And we're going to do outward rotation and inward rotation of the hip, external rotation, and bend this up. We're going to do external rotation and internal rotation of your hip, and straight down. Okay, we never hyperextend the knees, and we'll hyperextend your hip when you're standing. Okay, Tony, go ahead and do rotation of your ankle. Around, there you go. And we'll do dorsiflexion and extension. And the same on this one. Okay, dorsiflexion, extension, and rotation. There you go. There you go. I'm going to go ahead and check the Holman sign. Okay, any pain or discomfort in your lower calf as I push your leg back?
No.
Okay, and how about here?
No.
Okay, very good, Tony. Okay, Tony, you can go ahead and sit up for me. And I actually would like for you to stand for just a moment so I can check your spine while we have your shirt off. Turn this way and lean forward for me. This is going to be flexion of the hip as well. And I see no scoliosis, no lordosis, no kyphosis. Okay, Tony, you're welcome to sit back down and put your shirt on. And we'll continue with our range of motion. Can you turn your head side to side for me? against resistance, okay? Go ahead and push your head back, and forward. There you go. Now turn your head side. There you go, and suck this way. Okay, I'm turning it this way. There you go, and that way. Okay, Tony, shrug your shoulders for me. Yeah, that's the spinal accessory. Okay, and Tony, I want you to bend your elbows. That's flexion and extension of the elbows. Okay, we're gonna do external rotation and internal rotation of the shoulders. Okay, Tony, put your hands out in front of you for me, and all the way out for me. That's an extension. Okay, move back your sides. We're gonna do abduction and adduction. Okay, put your arms back out for me. I'm gonna hold them straight out for me, and I'm gonna let them go, and keep them there. Very good. And Tony, I want you to squeeze my fingers as hard as you can. Very good. Equal strength. Okay, Tony, I want you to bend your arms down. That's flexion, extension, hyperextension, rotation, ulnar deviation, and radial deviation. Okay, and put your hands back to normal there. And I want you to do the abduction, adduction. Now we're going to do this against resistance, okay? So don't open your fingers. Open them. There you go. Now try and close them again. There you go. Very good. And we did our wrist, and we do rotation of the thumbs as well. Okay, very good, Tony. Let's do pronation and supination of the hands. We're going to do pronation and supination, like you're holding a bowl of soup. And again, and again. Very good, very good. Okay. Now, Tony, what we're going to do is I'm going to have you stand up for me. And I want you to just, before you do this, I'm going to just take the screen and pan the room for just a moment, so that you can see that there are no help devices around. Try not to drop the camera here. And we'll go all the way around the room. I apologize if I'm making you dizzy. And let me see if we can see everything there again. I think right about there is where we had it. Okay. And Tony, I want you to turn this way, and I want you to walk for me. Heel toe. Good. And back. Very good. Okay, turn towards me. Now, I want you to just stand with your arms down to your sides. I want you to close your eyes. Very good. Open your eyes. Now, Tony, I want you to put your arms out, and I want you to touch your nose with both of them. Now, I want you to close your eyes and do that. One and the other. Very good, Tony. Okay, have a seat for me. Now, Tony, can you rub that heel across that shin? There you go. And do it the opposite direction. There you go. Now, can you cross your legs? Okay, now can you uncross and cross the other direction? Very good. Thank you. Okay, now what we're going to do is I have another little gadget here, and you're going to feel the vibration. Okay, and I want you to close your eyes, and I'm going to put this on different parts of you, and I want you to tell me when you feel the vibration has stopped. Okay, close your eyes.
No. 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 No.
Okay, very good. Tony, we're going to go back to our dull and sharp test, but I'm going to do it in multiple places on your body. And I want you to tell me if it's dull or sharp, and also point to where you feel me touching you. Okay, go ahead and close your eyes. Okay, and where am I touching you? Point to it. There you go. There you go.
Sharp. Dull. Sharp.
Very good, Tony. Now, I'm going to touch you with both ends of this. So this is going to be 2, and this will be 1. Okay, close your eyes for me.
2. 2. 1. 1. 1. 2. 2.
Okay, very good. see if you can identify this object.
Paperclip.
Very good. Okay, I'm going to take you by the hand, Tony. Close your eyes again, and I'm going to draw a number in your hand. You tell me what number I've drawn.
3.
Okay, we're going to do the same on the other hand, Tony.
2.
Very good. Okay, you can open your eyes up. Now we're going to check your reflexes. Okay, you just relax. Oh! Okay, pardon me. Okay, hold on, let me just turn the lights back on. Tony, I think we're just about finished. I just wanted to go over the cranial nerves again, just to make sure we covered everything. We have cranial nerve number 1, which was the olfactory. Cranial number 2 was the optic. Cranial number 3 was the oculomotor. Cranial number 4 and 6 are the trochlear and the abducens. Cranial nerve number 5 is the trigeminal. Number 6 we already said. Number 7 is the facial. Number 3rd is the acoustic. Okay. Number 6, 7, 8. Number 9 is the glossopharyngeal, and 10 is the vagus. We did that. Those were the ones that innervate when you speak. Number 11 is the spinal accessory nerve, and number 12 was the hypoglossal. Okay, thank you very much, Tony. Thank you.